So Tecfidera, or dimethyl fumarate, which is the chemical name for it, or dimethyl fumaric acid, all the same, is the third of the three oral medications, so-called disease-modifying therapies that are available for MS. It was approved on March 27th, 2013, and it is taken twice a day and has been shown to be effective in relapsing forms of MS, showing substantial reductions on relapse rates as well as on MRI scan activity, as we can typically identify in our studies. The mechanism of action, or how the drug actually achieves what it does for MS, is actually not known. And similar molecules have also been used to treat psoriasis, primarily in Europe, for many years. So there's a fair amount of experience with dimethyl fumarate and related molecules over the course of the last 20 years. The main potential side effects with this medication are mostly GI tract problems with belly pain, nausea, vomiting, perhaps even diarrhea. And these can be substantial and may affect up to 40% of people. Because of this, it's taken generally with food, perhaps even a fatty food, and that may help alleviate some of the symptoms. In addition, those symptoms tend to abate over time, and we also have a mechanism whereby we have patients start with a very low dose, maybe taking 120 milligrams once a day for 2 weeks, and then 240 milligrams once a day for 2 weeks, and then only going to 240 milligrams twice per day after about a month. This seems to lower the risk of having significant GI tract side effects. In addition, about 40% of people have a flushing sensation that comes on after taking the medication, maybe 30 minutes later, 20 minutes later. And this is very similar to what might be seen with those individuals who take niacin, the vitamin B, the product that's used to treat patients with high triglyceride levels. It's very transient. It doesn't generally hurt people, but it's very uncomfortable for some, and occasionally that's a reason that some patients may stop using the medication. We can also see a smaller number of patients may develop rashes, maybe up to 7 or 8% of patients. Generally, these are relatively mild and don't stop people from using the medication. There's a modest amount of monitoring that's required for this. We only really need to check complete blood cell counts, perhaps liver enzymes occasionally as well. But we check complete blood cell counts, especially the so-called lymphocytes, one class of white blood cell, which may be significantly diminished in 2 to 3% of people and moderately diminished in about 5% of people. It's become clear in the last several months to a year or so that a small number of people may have a very large reduction in their lymphocyte count, and this may be related to some risk associated with the medication. There's perhaps a slight increased risk of infection, and there has been a single case of progressive multifocal leukoencephalopathy, or PML, which we know very well is a risk associated with natalizumab or Tysabri. A single case has been associated with that with Tecfidera. A small number of cases have also been seen with some of the other dimethyl fumarate molecules that have been used in Europe to treat psoriasis. It seems that for most of these cases, there was a very low lymphocyte level for a prolonged period of time, and so the monitoring is focused primarily on looking at the levels so that they're maintained above 500 or 0.5 in the blood. Whether or not this turns out to be one particular subclass of lymphocytes, so-called CD8 cells that are affected, is not clear, but present evidence suggests that a subclass of these lymphocytes may be extremely important. The clinical trial data with Tecfidera dimethyl fumarate is quite impressive, and many people would categorize it as a highly effective medication, perhaps not as effective as the most effective medications, but certainly greater than many of the older medications that are presently and still in use. So we use this medication in those individuals who are newly diagnosed. We use this medication in those individuals who perhaps have been using an injectable medication for a long period of time and either are having struggles tolerating it or perhaps have new disease activity. And we use it sometimes as well in patients who may have been on natalizumab and can no longer use that, or perhaps other medications and need to transition to another one due to risk issues. So I'd say it's had a very good start with us with its use in MS, and we anticipate using it for a long period of time.